Hey, good afternoon, everyone. My name is Mary Hurlbert, and I'll be doing the presentation today. I'm a volunteer ombudsman, and education is what I do mostly. I'm here with Linda Kurdahl. She is an ombudsman and the volunteer coordinator for our office. Today, we're going to talk about residents' rights. Oh, more housekeeping, I forgot. Please save your questions until the end. The presentation will last about 30 to 45 minutes. Linda will be answering questions because she is the expert. And most of the time we have a chat thing where you get to hold up your hand or you get to type something in, but we haven't been able to make that work today, but apparently everything else is working, so that's just a minor thing. We are part of Pro Seniors. We are the long-term care ombudsman office that serves Hamilton, Butler, Warren, Clinton, and Claremont counties. This year's theme for Residents' Rights Month, and that's what October is. Every year we remind residents, staff, families, everyone what those 33 additional rights are that residents in nursing homes have. This year's theme for Residents' Rights Month from the National Consumer Voice is Reclaiming My Rights, My Home, My Life. Any one of you who has been working in long-term care for the last year and a half understands that some of those rights have had to be taken away during the pandemic. When the pandemic arrived in 2020 and emergency orders were issued by the Central Medicare Services and State of Ohio, some residents' rights were suspended. Those emergency orders have been lifted. Residents' rights have been restored. This is the first step to life becoming more normal for everyone. There are 33 rights defined under the Ohio Regulatory Code. I'll just hold this up. We have brochures. We're more than happy to send them out to you if you call and ask for them. Residents' rights encompass every single aspect of the resident's life, and they can be divided into two themes: quality of care, quality of life. As an ombudsman program and best practices for the industry, our approach is person-centered care, looking out for the individual. So quality of care. Nursing facilities must provide services and activities to maintain the highest practical physical, mental, and psychological well-being of each resident through a care plan. Emphasis on the word each. Quality of life. The facility must care for its residents in such a manner and in an environment that's going to promote maintenance or enhancement of the quality of the life of each individual. So the most important things from this is each individual and the care plan. The role of the ombudsman. I'm sorry. Okay. First of all, an ombudsman, normally our visits to your facility we can come unannounced. With COVID, we do call ahead first and ask if you're in active outbreak testing. And if you are, we'll ask you when you will have the testing complete, any cases, and in any cases that are isolated. Note that the long-term care ombudsman is a governmental representative and an essential worker. And because of that, we have access to your facility at any time, including if there's an outbreak. We will follow your screening procedures and we will wear an N95 mask. We try to do everything possible to keep everyone safe. And I'm so sorry, that's my phone. Turn it off. Active advocacy and representation in long-term care residents for quality of care and life. educate the residents, the staff, and the family. That's educating staff today. That's what we're doing today. Yesterday I did residents. We want to empower residents to speak up for themselves. Remember, we are resident-focused and person-centered. We're looking out for what the resident wants done. And we want to create an avenue for communication with staff. This is not us versus them. This is communication. We want to create that avenue for communication because lots of times it's just a matter of, even though we're all speaking the same language, not understanding what the other is saying. So if we can do that when it's just a small irritation, instead of waiting until it escalates into a big problem, that's wonderful. We want to empower your residents to speak up for their quality of care. You know, sometimes they don't know who to talk to resolve an issue, or they're afraid to speak up. And it's not that they're afraid because anybody's been mean to them or done anything wrong, but you know, when they enter into this communal living, they're at a very vulnerable time, and they're worried and they're afraid, even if there is no reason to be afraid. Complaint investigation and resolution. We want to partner with you for the resolution. As the Office Ombudsman, we do have the right to see your policies, your procedures, and only with the residents' consent do we have a right to see their medical or billing records, and we will get their consent in writing before we do that. We want to partner with you, help solve residents' concerns, so please feel free to call your ombudsman to talk over any situation. It doesn't necessarily have to be a resident, it can be you. And then for your provider consultation, just dial 513. Remember, after Sunday, you have to dial 513-458-5518. Okay, residents' rights. The right to a safe, clean environment. Because of COVID, again, still haunting us, some residents are eating in their rooms. Do you have additional cleaning or additional pest control services in place because of that? Abuse. They have a right to be free from physical, verbal, mental, emotional abuse and to be treated at all times with courtesy, respect, and full recognition of dignity and individuality. Remember, abuse is intentional and deliberate, and the perpetrator can be anyone. It can be the staff, but it can also be somebody's family, another resident. It can be a perfect stranger, and we'll talk about that later in the presentation. Residents have a right to all reasonable requests and inquiries responded to promptly. This includes call bells. It's very important that those bells are answered quickly. I talked to somebody a couple of weeks ago, and she was in rehab, but she was at a nursing home, and she was only going to be there for a week, so it was no big deal, she said, and she didn't want to complain about it. But she put her call bell on. It's on the weekend, and she already knew they were short-staffed, but she put her call bell on at 11 p.m. No one responded until 2 a.m., and their response when they came in the room was, you know, you don't have to keep ringing the bell. One time is fine. And she said, well, I just assumed that you didn't hear it. That's why I had to keep pressing the button. I will tell you after that, they did respond to her more rapidly. Residents have a right to have clothes and linens that are changed as needed to ensure their comfort and sanitation. So it may be policy to routinely change linens every 3 days or whatever, but if someone has an accident in their bed, well, you know, it needs to be changed now. They have a right to obtain from a provider, upon request, the name of any specialty or physician or other person responsible for their care or for the coordination of care. They can absolutely refuse to serve as medical research subjects. And I wouldn't have thought that this would happen very often. But when COVID came along and they were trying to get a huge number of volunteers very rapidly to test for the vaccines, what better place to go than this vulnerable population where you would have a whole group of people at the same time, and all we need to do is contact the administrator, but that's not true. Each individual needed to be asked, and each individual had a right to say yay or nay. The right to accept the physician and pharmacist of their choice. You know, if they've been seeing the same doctor for 30 years, they probably still want to see him or her when they're in the nursing home. And they have a right to participate in decisions that affect their lives. That's going to be the care plan. The resident needs to be at the care plan meeting. We know of an instance where the care plans are rubber stamped. They appear to be working. The resident hasn't complained. We're happy with it. Okay, we'll just do it again. Or reissued without the resident's input at all. It is time and coordination, but it's the right of the resident to participate in their care plan and make other decisions. And sometimes, you know, you get there, you sign off on a care plan, this is what I like, and then you realize after you've been there for a while that the resident would like to make some adjustments now that they're living in a communal atmosphere. And that's the perfect time to let that be known, but not if the care meeting isn't held. They have the right to confidential treatment of personal and medical records, and to approve or refuse the release of these records to any individual outside the home, except in the case of a transfer to another healthcare provider. So they have control over their medical records. We don't. As an ombudsman, I would have to ask if I could see certain records, and then I would have to get written permission to do that. We all have a right to privacy during care. So doing a quick assessment during dinner or beforehand, or handing out medications while everybody's sitting in the dining room, it certainly makes the day go easier, but it's not right. If a resident has a medical question they want to ask, they may not want to ask with all of their buddies around there. So that has to be done in private. The right to be free from physical and chemical restraints for prolonged isolation. Okay, before that can be done, the attending physician has to make a personal examination and make a determination on the use of the restraint. Personal examination means he has to come to the home and speak with the resident. You can use an emergency situation for protection for themselves or others, but that can't last for more than 12 hours from the onset without an examination and authorization by the attending physician. Even the physician can't authorize it for more than 30 days. Any additional period of not more than 30 days beyond that, they have to have written authorization and a reason stated for its continued use. Under restraining, facility shall ensure the resident receives proper diet. Restraint can never be used for punishment or incentives or for somebody else's convenience. Residents have a right to exercise all their civil rights unless they've been adjudicated as incompetent and they have a guardian. So we have to deal with the resident even if maybe that's a little difficult. They have a right to access opportunities that enable them to achieve their fullest potential. Educational, vocational, social, recreational programs. They have a right to access them, but we can't force them to do that. I love this one. The right to consume alcohol at their own expense per facility policy. That doesn't mean you need to let someone drink themselves into a stupor so that they can't even walk down the hall, or that they can drink any place they want to drink. The right to use tobacco at his or her own expense per the facility's policy. So if the facility says you can smoke, I guarantee that there's going to be certain places where you can smoke, and none of your residents are going to be allowed to smoke in their bed, because I always have a cigarette right before I go to sleep. You can't do anything that's going to endanger other residents. The facility may have a policy, and those have to be followed. The right to retire and rise as at the resident's reasonable request. Well, I like to get up at 6 a.m. I think that probably would suit the schedule at a nursing home just fine. I have one sister-in-law who doesn't want to get out of bed till 10 a.m. and she doesn't want to talk to anybody until 11:30 or 12. We don't want to be roommates, ever. She also stays up till 2 o'clock in the morning. But reasonable requests should be honored. And the right to observe religious obligations and participate in religious activities, no matter what they are, to maintain our cultural identity, and to participate in social and community groups. So, if I'm Muslim and I need to pray 5 times a day, I have a right to do that. Arrangements need to be made. If I want to eat kosher, then I'm entitled to that. These are all things that have to be discussed in the care plan and followed. The right to private and unrestricted communication. You get to send mail that's sealed and unopened. You get to receive mail that is sealed and unopened. There needs to be a telephone so that you can have a private conversation with someone. Now, I realize probably 75% of us in nursing homes today have our own cell phones. But if we don't, there needs to be a phone available for our use where the whole world doesn't know what we're talking about. And we're entitled to have our family and friends visit at any reasonable hour. The right to a private visit by your spouse, obviously. The right to have our room doors closed and have them not open without knocking. That needs to go a little further. Knocking as you walk in the door is what I do when I go to my sister-in-law's house because I'm her caregiver. Knocking when I'm going into a room in a nursing home requires me to wait until the resident says, come on in, or who are you? And all residents have a right to retain and use personal clothing and have a reasonable amount of possessions. Okay, residents' rights. They can't know them if they can't see them. The right to be fully informed in writing of basic rates charged, services available, additional charges related to such services. If you're in assisted living, for instance, then let's say I'm the one in assisted living and I decide that I need some help getting to the dining room. So I say, do you suppose you could bring me to the dining room every night? No problem, Mary, no problem at all. And then I get my bill at the end of the month, and each of those walks to the dining room costs more money. I need to know the basics rates charged and anything additional charges. Obviously, we have the right to be free from financial exploitation. And who commits that exploitation? It's not just staff. Don't want you to think we're picking on you. It can be family, friends, owners, aides, other residents. It can even be strangers. Grandchildren especially. I have to tell you, I might be able to tell my children no, but I'm not sure I could tell my grandchildren no, even if in my heart I thought they were maybe just a little pushy to get that money. If you suspect financial exploitation and you're a mandatory reporter, you're obligated to report. So please know your company policy and what you have to do. You can also call the Ombudsman office. And we have residents have a right to unrestricted access to their property that's on deposit. And of course, again, that's at reasonable hours, probably not 3 o'clock in the morning. The right to receive reasonable notice before a room or a roommate is changed, including an explanation of the reason for the change. So I spoke yesterday to some residents at a nursing home, and one woman said that she was about to be within a month on her 4th roommate. And I sort of wondered why. And she said, oh, it's okay. One of them was only supposed to be here for a week, and she stayed for a week. And she said, you know, one of them died. Can't do anything about that, so she had to be replaced. And I forget what the 3rd one was. But a resident, we have 2 residents who are living together happily. They need an explanation for reason of change. They can't be transferred without appropriate notice, and they have to be given a reason. They have a right to voice grievances and recommend changes in policies and services. And this also includes access to the residents' rights advocate, which is the Ombudsman. The right to have any significant change in health status reported to their sponsor. No one wants to have someone in a nursing home, a loved one, and show up one Sunday afternoon and be told that mom or dad or grandpa got really, really sick last Wednesday. We almost had to send him to the hospital. You know what? The family needs to know that. Notices of roommate change, by the way, were temporarily suspended with COVID, but we need to go back to the best practices, which is to let a roommate know they have to be moved and why. Resident Rights number 33 was just added in October 2019. It took them a long time to get on board with hospice. Residents now have the right to request the care and services of a hospice care program and to choose their choice, a licensed hospital care program. And I do have a friend in a nursing home that is being treated through hospice now and doing much, much better with that extra kind of care. So it's a help for the resident, it's a help for the staff. Abuse, neglect, and exploitation, you know, this is horrible. Remember, the resident always has to be free from any kind of abuse, neglect, or exploitation, because these are really serious matters. We want to give you some more extra information. Abuse is purposeful, not accidents. If one resident accidentally bumps into somebody and knocks them down a flight of steps and they break their leg, that's an accident. If somebody shoves somebody every single time they're within 18 inches, that's physical harm. There can be sexual intimidation. People just being cruel because they've had a bad day or because they're just mean people. Psychological anguish of an older person by another person or entity. Nursing home regulations require reporting allegations of abuse, neglect, or exploitation immediately. So know where you have to report, because you have to report within 2 hours of the allegation. You can report no later than 24 hours if you just suspect neglect or exploitation and it doesn't result in bodily injury. If there's suspicion of a crime, it needs to be reported to law enforcement and the state survey certification agency, which is the Ohio Department of Health. Know your policy and know who you need to report to. Remember that multiple forms of elder abuse often occur at the same time, and it can be hidden. So look for things. Okay, who are the abusers? I think we can't go through this enough. Caregivers, back facility staff, volunteers. We have all kinds of volunteers went in before COVID. Other residents, spouses and partners, or other family members, strangers. But here's who the mandatory reporters are: healthcare professionals, clergy, social workers, psychologists, pharmacists, the dialysis technician, the firefighter, the EMT, the ambulance driver, CPA, certified public accountant, a bank employee, financial planner, counselors. Notice who's not there. The ombudsman is not there as a mandatory reporter. These other professionals are, including banks, because they may often be the first ones. The teller at the bank may be the first one to think something's not right here. Ohio law states that a report must be made if you have reasonable cause to believe that an adult is being abused, neglected, or exploited. You can make those reports anonymously. You'll have to the Ohio Department of Health, to the police. Let them know that you suspect that a son is stealing from the resident and that you have reason to believe he may act badly if his access to his father is restricted. You might ask them at their bank when you suspect that a senior is vulnerable and being pressured to give up his funds to somebody else. Social Security. Notify them if circumstances for the individual, like unpaid bills, lack of cooperation, applying for Medicaid, they don't want to produce bank statements. If a client has a guardian and you suspect the guardian is a perpetrator, notify the probate court. If the suspected perpetrator is applying to serve as a guardian, notify the probate court of those concerns. Okay, long-term care ombudsman. We just explained who we were, and I hope you understand. And I hope you understand that we are centered on the residents, but we are here to help everyone and to facilitate that communication. And you call us directly at 513-458-5518. And then we have the Ohio Senior Medicare Patrol. We help seniors prevent, detect, report healthcare fraud, errors, and abuse. We work one-on-one with Medicare beneficiaries to educate them about healthcare fraud and identity theft. The biggest targets of identity theft, by the way, if you don't know it, are seniors. If you have a resident or you are concerned about your Medicare statement, call us. If you have a question about protecting your Medicare number, call us. Can't understand your summary notices, call us. We also have legal service. We provide free, emphasis on the word free, legal information, advice, and referral for residents of Ohio. The only stipulation is you have to be at least 60. Doesn't matter how much money you make or how many resources you have. Call the office, 513-345-4160 to set up an appointment. So you call the office, someone will speak with you, decide which attorney would be the best to work with you or a resident, and set up a time for you to have a 30-minute conversation with the appropriate attorney. Right now, we're doing a lot of providing information related to pensions and retirement benefits. But they also give plenty of advice about preventing financial exploitation, and they help resolve the legal problems caused by financial exploitation. And thank you. I'm so glad to have spent this last 35 minutes with you. And I believe Linda and I are about to change places because she is the expert and she's going to answer any questions you have. And I thank you very much for your time.
Okay, thank you, Mary. Appreciate it. So, as Mary said early on, we didn't have our chat box working, so sorry about that. But I'm gonna do my best here to take anybody off of mute. And if you have questions, let me hit the right button here to do that. As Mary said, as the Ombudsman Office, we are here to work with you, and we're here to solve any problems together to help the residents attain the best practicable living standard. Okay, and I also want to mention, because October is Resident Rights Month, we have Mary and we have other volunteers who are happy to attend the next resident council meeting that is scheduled, and we'll do a little training with residents on their rights. And then I also want to briefly mention family councils. That's another area where we're happy to try to advise and help facilitate maybe the formation of a family council. And having said all that, I am still having trouble getting everybody off of mute. There we go. I think I've done it. Okay. Well, I don't know that I have taken you off mute, so I certainly apologize for that. Everybody who registered for the webinar, I have your names here. Okay. So now you need to mute, please. Oh, I'm so sorry, you guys. Okay. All right. If you unmute yourselves, we do have a little echo thing going on here right now, and try to take care of that. If you unmute yourself, you can ask a question. Okay, if there are no questions, yeah. All right, very good. Thank you for attending, And again, if you logged on to today's webinar, we'll send out certificates of completion. And this has been recorded so that you can share it with others in your organization. All right, thanks everybody. Appreciate your attention today. And feel free to give us a call at any time. Thank you.